Actor Cary Grant in 1977.
It's a pity your own foot can't slip a little sometime. But your sense of inner divinity wouldn't allow that. This goddess must and shall remain intact.
America's 37th President Richard Nixon in 1994.
Now, the usual political thing to do when charges are made against you is to either ignore them or to deny them without giving details. I believe we've had enough of that in the United States.
The UK's ex-Prime Minister Winston Churchill in 1965.
Now we are the masters of our fate. That the task which has been set us is not above our strength.
Comedian Curly Howard in 1952.
Sounds like there's a bear down there. I'm going to get a trap.
Wait a minute. How can there be a bear down there?
It's barely possible.
Yeah,
All these people died after suffering a stroke. Their primary cause of death may have been different, but an episode of stroke played an important role in their ultimate demise. Hello all, welcome to our podcast, The Prescription on Earshot Media. I am your host, Dr. Karan Thakur. Hope you're all safe and sound. It's World Stroke Day in 2 days. October 29th is marked as World Stroke Day. Each year, the focus is on a different aspect of stroke. This year, the World Stroke Organization is placing its focus on improving awareness of stroke symptoms. A stroke occurs when the flow of blood is cut off from a part of the brain. The brain cells start dying within minutes as the supply of oxygen in the bloodstream stops. In 2019, a study by the Lancet Global Health reported that nearly 7 lakh Indians had a stroke which led to their deaths. That's 7.4% of the total deaths in the country. A staggering number. Listeners would recall that on our first episode of The Prescription, we had touched upon the subject very briefly. On this episode, we intend to do a deep dive.
Indraprasth Apollo Hospitals presents The Prescription in association with Earshot.in.
On today's episode of our podcast, The Prescription, we will be joined by Dr. P.N. Renjen, Senior Consultant Neurology at Indraprastha Apollo Hospitals, New Delhi, and one of India's foremost authorities on stroke. Welcome to our podcast, Dr. Renjen.
Thank you very much.
Before we started recording, Dr. Renjen, there was an interesting anecdote that you were mentioning about Winston Churchill. I think our listeners would love to hear that.
Thanks, Karan. I think I'll start the discussion with talking a little about history because history is always important. Some of you must be aware that 1945, the declaration at Yalta, where we had the 3 great people, Roosevelt from the US, Stalin from Soviet Union, and Churchill from Britain. Now, all these 3 guys met to decide the future of Europe after the Second World War. Interestingly, 20 years later, Roosevelt, 3 months later, died of stroke, of a hemorrhage in the brain. 8 years later, Stalin died of hemorrhage in the brain. And Winston Churchill died 20 years later, but he was sacked to be the Prime Minister because of wrong decisions he made during the Suez Canal episode. So you can realize that all these 3 great men who did everything after the Second World War suffered from stroke. Hence, it becomes very important for us to appreciate, to diagnose a stroke, treat a stroke, and prevent a stroke.
So that's a very interesting aspect that you brought out about how strokes are actually quite common. They may not have been discussed so much earlier. And before we discuss the symptoms and the other issues around stroke, I'd just like you to inform our listeners about what is a stroke and what are the different kinds of stroke?
Well, a stroke is a sudden onset of a neurological deficit, which will mean that out of the blue, you get a weakness in one half of the body. That could be one symptom of stroke. You could have a weakness, you could have difficulty in walking, you could have difficulty speaking, you could have difficulty in coordination. Primarily, there are 2 types of major strokes. One are called ischemic strokes, which are because of an clot which is obstructing an artery, as a result of which that area does not get enough blood supply. This is called ischemic stroke. The other strokes are called hemorrhagic strokes, which mean because of uncontrolled blood pressure, you have an artery which bursts in the brain and collect the blood there. Right. Basically, the symptoms and signs of ischemic stroke and hemorrhagic stroke are the same.
Right. So, in that sense, there are two types of strokes, and they manifest in the same way. So, what are the common signs and symptoms of a stroke?
The common signs and symptoms of stroke, I would put in a very simple way: FAST, F-A-S-T.
So that's an acronym, F-A-S-T.
Yeah, right. Please remember that.
Right.
Your face to one side, drift of the arms, speech problem, time, run to the nearest stroke center.
So, is it possible that some of these symptoms that you mentioned in FAST can actually be something else?
Well, no, I would say no. I would say any symptom which occurs out of the blue, whether it is a stroke or it is not a stroke, needs immediate attention.
So, in that sense, you've mentioned that, if you find the FAST symptoms, let's say, you should immediately go to a hospital. Why is it important to go immediately to a hospital? Because many times we see people may want to wait it out, may think it's something else. Why is it important? Why does every minute count, as we say in strokes?
Very nice. See, the point is, question why?
Yeah.
You might ask me, what am I going to do if I come to a hospital? I can do a lot for you. If you come to us within first 3 to 4.5 hours, I have drugs to dissolve the clot, which is called thrombolytic therapy. It doesn't stop there. You can come to us at 6 hours, 9 hours, 12 hours, 24 hours. We can still help you in a small percentage of cases. But the earlier you come, the better you are.
And are there different symptoms for men and women, or are they mostly the same?
Well, that's a very, very interesting question. Well, I would say the symptoms in men and women differ. They are practically the same. But maybe a woman has the power to ignore certain symptoms. She will ignore them. But a man may say, no, this is a very important symptom. But basically, the symptoms remain the same.
Right. And we also read about and hear of cases of a mini stroke. What is a mini stroke?
A mini stroke is a TIA. That's called a transient ischemic attack. To make it more simple for you, it's an angina of the brain. Everybody is worried about the angina of the heart. I hope a mini stroke, a TIA, is appreciated as much by the people and taken as quick an action as you take action for the angina of the heart.
Angina is the pain that you would get in the heart.
Yes, angina is the pain.
So what is a sign that one would look out for and sort of know that this is a TIA?
Well, the signs of the TIA would be the signs of a stroke. The only thing means that if it's transient, it goes away. A TIA by definition, anything which is 1 hour and below is a TIA. Anything beyond 1 hour is a stroke.
And as it turns out, the causes for strokes can be many. More often than not, old age and family history are amongst the things that make you more likely to get a stroke. The Lancet study published in 2019 noted that the burden of non-communicable neurological disorders was increasing in our country, mainly due to the aging of our population. Now, you can't turn back time or change your bloodline, so it becomes imperative to know its causes and prevention. In 2015, stroke was the second most frequent cause of death after coronary artery disease, accounting for 6.3 million deaths in the world. These statistics are attributed to the Global Burden of Disease study published in 2015. This is clearly not a small number. So, Dr. Renjen, what are the causes of a stroke? We've understood the symptoms, what to look out for, but what causes a stroke?
Well, as you very rightly said, that the causes of stroke are different in a young person and different in an adult person. So we'll first talk about the adult population which gets a stroke. Well, the commonest cause is atherosclerosis, which would mean the thickening of the vessel, which is a preventable cause of stroke. You can't fight age, but certainly you can treat diabetes, blood pressure, hypercholesteremia, and have a good quality of life and have lifestyle changes in your own life. More importantly, I would stress that as age advances, heart becomes a very important cause of stroke. And we have an abnormality of the heart, which is called atrial fibrillation, which causes strokes in the elderly.
So that is basically the effect, stroke is an effect. So would you say that that is correct, that the primary cause could be like an underlying disease?
Correct. See, a stroke, the patient comes and tell you that I've had a stroke. It is for me, the neurologist, to find what is the cause of the stroke, because the treatment is going to be different. So my job doesn't end there. My job, in fact, starts there.
Right. So you would then look for why the stroke happened.
Correct.
So for patients and for listeners, how can we prevent a stroke?
Interesting question. I'll put it in a very simple terminology. There are two types of risk factors: modifiable, non-modifiable. I can't do much about the non-modifiable risk factors, which means age, which means genetics.
Right.
But I can do everything for you for modifiable risk factor. And please understand that if you modify these risk factors, you save a stroke in 40% of patients.
So we can actually reduce the burden of strokes by 40%,
40%
if we address the modifiable risk
What are the modifiable risk factors? Very simple: diabetes, blood pressure, hypercholesteremia, stop sedentary lifestyle, improve your lifestyle, and for women, oral contraceptives. If you do this much for yourself, you can prevent a stroke.
And what about the non-modifiable risk factors apart from age? Is there a genetic predisposition towards
Absolutely,
strokes?
there is a genetic predisposition for stroke. And I would say what genetic predisposition really means: stroke is more common in families where there's diabetes, where there's hypertension, where there is hypercholesteremia. Atherosclerotic process becomes much faster.
So once again, if the causes are the same in the family, the effect, that is a stroke,
Correct.
will also be the same
Absolutely.
in the family.
Absolutely.
Right.
Absolutely.
In most cases, a person suffers a stroke more than once, and a stroke does not always result in death. But it may have its effects, like vascular dementia or stroke paralysis. About 1 in 4 people who have had a stroke will develop signs of dementia. Another common disability resulting from stroke is paralysis, where a person is unable to move his or her muscles or body parts. The immediate fallout for 90% of stroke affected people is paralysis of some degree. Dr. Renjen, one of the common things that one sees as a sign is some sort of paralysis, one or many parts of the body not working. So how common is paralysis post-stroke?
Current point is, it all depends upon what is the neurological deficit when you come to us. After all, 30-40% of strokes make a near total recovery. 30-40% get back to normal lifestyle. 20% are bedridden. But I would like to stress one thing more, which you just talked about: a post-stroke dementia.
Yeah.
Stroke is just not paralysis on one half of the body. Stroke affects the memory. Stroke affects the language. Stroke affects the orientation. As you very rightly said, 25 or 27% of patients in post-stroke period dementia. In our own study, which is published, and out of this, if you take good care, you can prevent this dementia. I always use the word, this is a preventable dementia.
That's very interesting. So you're saying that even if you get a stroke, and that can be for various reasons, the paralysis and even the dementia can be reduced or prevented, provided you come in time or you take some of the interventions that you mentioned?
Absolutely. First of all, I can prevent the dementia, then I can treat your dementia. But the ultimate aim of a neurologist is to get a patient back to his activities of normal living.
And you mentioned that 30-40% people go back to life as normal. Is that true? So after a stroke, and a lot of our listeners may have somebody that they know in their family, or may have just come across an episode of stroke because of, we've seen the rising incidence due to COVID and other reasons. So what is the message to them that post-stroke life can be normal?
Yes. My message, and a very clear and loud message, is prevent stroke, treat stroke, prevent complications. And that's what the neurologist is here for.
And there is another aspect of strokes which is not much discussed, which is that the caregiver also has to play a very important role, because many a times the person who's had a stroke may be incapacitated to do many activities. So my first question is, what is the follow-up treatment like post your stroke episode? And second, what advice do you have for caregivers to manage a person in the household who has had a stroke?
Karan, you asked a very relevant question. The first thing is, in a post-stroke period, there should be good rehabilitation. Rehabilitation only doesn't mean physiotherapy. Rehabilitation means teaching him memory functions, language function. Patients are depressed, treat their depression, and most importantly, they deserve a tender, loving care. And that itself speeds up the recovery of our stroke patients.
And typically, do you see that the care that is provided post stroke and the care that the caregiver gives actually helps in recovery?
Absolutely. I mean, our Indian system is we are a joint family system. And I think if the family cares for a stroke patient, the recovery is far better than a nurse or somebody else taking care for a stroke patient. As I said, a stroke patients require a lot of sympathy and empathy.
And what is the unfortunate mortality that you see in stroke cases usually?
Well, the mortality depends upon the type of the stroke. As I said, there are two types: ischemic stroke, hemorrhagic stroke. I would say hemorrhagic stroke has higher mortality than ischemic stroke. But when a person survives, hemorrhagic stroke do better than ischemic strokes.
So in terms of which stroke you get, that also determines the outcome. Yes. But you're saying that with interventions, both treatment, post-care rehabilitation, and the support system that you get, you can make a full recovery.
Absolutely.
That's very interesting to know. So in all the gloom and doom, what I'm hearing is also that it's not necessarily a death sentence.
Yes. I would, as you rightly said, I would say, please be more positive. Take away this negative, nihilistic approach to stroke to a positive approach to stroke.
And what about support? I know that you run a support group for post-stroke patients and their families. If you'd like to talk about that, and two, how does that help?
Well, very interesting again. We have an Apollo stroke support group. Before the COVID areas, I used to have this meeting once in a month. But now, of course, we are having a meeting this 30th of this month. Now, what is the Apollo Stroke Support Group? An Apollo Stroke Support is group. Stroke patients, their caregivers, their neighbors, their well-wishers, they come to us in a group. We tell them how to prevent a stroke, how to look after a stroke patient. Please, if you think your neighbor has had a stroke, you will not have one. It's not true. You could have one. So please, by coming to these groups, we give confidence to our stroke patient. We have some stroke patients who come and tell them, how in the hospital they have recovered so well. So the purpose of the stroke group is to encourage rehabilitation, encourage these patients to get back to normal life.
And you're involving everybody who is directly or indirectly involved.
Absolutely.
So that awareness also increases.
We involve our physiotherapy department. We have one of the good departments. They are there. We are there. Clinicians are there. Residents are there. Entire stroke team is there to encourage these patients. And I have found great use of this Apollo stroke support group. And I think everybody in his own area should have a Apollo stroke support group.
And this goes beyond, my next question goes beyond you as a clinician. Since the incidence is rising of strokes, what more does India need to do?
See, a very good question again. As Karan very rightly said, we have mastered the communicable diseases. Now what is happening is India is becoming the hub of non-communicable diseases.
These are diabetes, hypertension.
And diabetes and
all of these,
hypertension.
right.
So if you want the incidence of stroke and heart disease to decrease, you have to look after your diabetes, blood pressure, hypercholesteremia, and the diet and the health of our patient. I always say that the work starts in your workplace. Even when you are working, you're sitting in your office, you can be just moving your hands or legs is enough to prevent a stroke. So most important is, please get physically more active, change your lifestyle, change your diet, and you will prevent stroke.
So it's not just about the stroke, it is your entire lifestyle and also how we work, how we live. All of those issues are
a part of it.
In our last section of the podcast, we usually bust myths around the subject that we discuss. And today that we're discussing strokes, there are lots of myths that are going around, some on the internet, some through word of mouth. So I'd just like the expert's view on that. Dr. Renjen, is it true that strokes happen only in the elderly?
Absolutely wrong. Strokes occur more after the age of 65 years. Any stroke which occurs before 45 years is called stroke in the young. The causes of stroke in the young are different from causes of stroke in the elderly.
But it does happen in the young.
It does happen.
And is it true that stroke symptoms are not identifiable?
Yes. What happens is that suppose, I'll give you a very small example. You have a little bit of numbness in your hand. The usual reaction is to just move your hand left and right.
It's a cramp or
cramp.
something.
And half an hour, 40 minutes down the line, the symptom is anyway gone. So you say, okay, fine, there's nothing wrong with you. Why should I go to a doctor?
And strokes and seizures are the same thing. This is a myth that goes around.
No. Stroke is absolutely different from a seizure. A seizure is an epileptic seizure. A stroke is a vascular phenomenon.
A vascular means the blood vessels.
Blood vessel phenomenon.
And strokes can be healed by aspirin?
I won't use the word healing, but I would use the word stroke can be prevented. You can prevent 40% of the strokes by consuming one tablet of aspirin of 75 milligram 3 times in a week.
Smoking and alcohol do not affect strokes?
Absolutely not. Smoking is the worst risk factor of the stroke. Smoking combined with diabetes and hypertension, very high chances. Alcohol is a bit of a controversial matter, but I would still say that if one is consuming 30 to 60 pints of alcohol once or twice a week, no harm done. But if you're a binge drinker, definitely alcohol is harmful.
And when you say smoking, that includes tobacco also?
It
Chewable
includes tobacco also,
tobacco
absolutely, yes.
As a whole is...
Yeah, as a whole.
And what about alternative medicines? A lot of people now rely on alternative medicines for post-stroke or to even treat stroke. What is your view?
Thanks, Karan. A question you asked, which I am very fond of. At the Apollo Hospital, we have just launched a holistic form of medicine. You'll be all very glad to know that I, being an allopathic doctor, do believe in holistic medicine. And we have tied up with the Indian Institute of Ayurveda, which is very close to our hospital, for neurorehabilitation of stroke patients by holistic methods. So that's going to be, if the trial comes out well, is going to be a landmark trial.
But you're using the science behind this before you get to a conclusion.
Absolutely, absolutely.
So alternative medicine also has a part to play, but as part of a holistic approach.
Holistic approach, correct.
It cannot replace
It cannot replace it.
Right.
No holistic medicine can replace aspirin.
So as we sign off, Dr. Renjen, it's a gloomy subject. Stroke is a gloomy subject, unfortunately, even though it's prevalent. But what is the positive that comes out of it? As you would have seen, you see hundreds of patients of stroke. What is the positive thing that you would
Karan,
like?
I would beg to disagree with you. It's not a gloomy subject.
Right.
It's a subject where I have a passion for. That's why I won't call it a gloomy subject. I think we should all become partners in the treatment, prevention of stroke. And I'm sure we would be able to win over stroke, win over the non-communicable diseases in India.
And since the show is called The Prescription, what is your prescription for anybody who's listening out there? How can you prevent a stroke?
My prescription is, if you have a stroke, please go to a doctor. Please look after your diabetes and hypertension. And if you have a stroke, don't hide that you have had a stroke. Please get yourself treated. That's my prescription.
Thank you, Dr. Renjen, for coming for this podcast and for enlightening us on the subject of stroke.
Thank you very much.
It was really a wonderful conversation.
Thank you.
That was Dr. P.N. Renjen, stroke specialist from Indraprastha Apollo Hospitals, who joined us for this edition of The Prescription. Do encourage your friends and family to listen to our podcast on Earshot.in or the Earshot app. It helps our tribe grow. Till the next episode, stay happy and healthy.
Indraprastha Apollo Hospitals presents The Prescription in association with Earshot.in.
Earshot, here and now.